Hi, Austin. My name is Stone Manzik. I'm a nurse practitioner student with Youngstown State University. Today we'll be doing a full head to toe assessment. This exam should take anywhere from 30 to 45 minutes. We're going to do review systems, run a couple tests, just look at some skin, listen to some areas on your body, and we'll go from there, okay?
Alright, sounds good.
Before we begin, do you have any questions?
I do not.
Alright, so how are you feeling today?
Good.
Do you have any health related concerns or issues that you want to bring to my attention?
No, not right now.
Okay, awesome. So let's begin. The first test, we're going to inspect and palpate your skin. Make sure I can see myself decent enough. Okay, looking at his skin, looking for hygiene, good hygiene, color appropriate for ethnicity, minimally moist, good warm temperature with the back of my hand. Testing for turgor. Good skin turgor. Same thing with the legs, color appropriate for ethnicity. No lesions, no bruising. Do you have any pain anywhere?
No.
Good. Okay. No bruising. Smooth texture. Okay. Bilateral upper and lower extremities are good. Now we're going to look at your nail bed. I'm going to take my ruler and measure the angle of his nail bed. Less than 160. 160. 160. No clubbing is present on his fingers. Now I'm going to have you do the shamrock test, okay? I'm going to have you take your two fingers like this and put them together. Looking for any clubbing of the fingers, is spaced apart. Everything looks good. Minimal space in between. So no clubbing is present. Check for capillary refill. 1, 2. 1, 2. Other hand. 1, 2. 1, 2. And check his feet now. 1, 2. 1, 2. 1, 2, 1, 2. Okay, so capillary refill is less than 2 seconds on the bilateral hands and his feet. Now we're going to move on and look at his hair and his scalp. Use my toothpick. Scalp is symmetrical. Any pain?
No.
No pain present, no lesions. Smooth, soft in texture. He has thin hair. No bald spots, no cuts. No bumps, no masses. Skull is symmetrical. Good. No trauma present. Now I'm going to move on to his face. Looking at his face, symmetrical, evenly dispersed eyebrows, no lesions, no deformities, no masses, nothing like that. No pigmentation, no ticks are present with this face. Let's see, no bruising. Everything looks good. Now I'm going to palpate his frontal and maxillary sinuses. Any tenderness?
No.
Any tenderness?
No.
Good. So I'm going to also palpate his mastoid. Any pain or tenderness?
No.
Good. Sinuses are lacking of tenderness, no pain, no deformities, no pain present, no edema, no swelling on his face or his head, his scalp. That's noticeable. No pain, so we're looking good there. Now we're going to inspect and palpate his neck. You have any questions so far?
No.
Good. So looking at his neck for symmetry, it's symmetrical, fullness. Any pain?
No.
No pain or tenderness, no lumps, bruises, or masses present. Everything feels good. Trachea, midline. I'm going to check his hyoid bone and have him swallow. So swallow for me. Good. Hyoid feels intact. And then thyroid, feeling for any nodules. Any pain?
No.
Good. So thyroid is intact. Hyoid bone moves with swallowing, no issues there. Trachea is midline, so that looks good. No pain presented, so that's awesome. No nodules or enlargements felt during inspection or palpation. So now we're going to assess his lymph nodes. Just stays on. So I'm going to look for preauricular, before his ears, postauricular, occipital, sternocleidomastoid, using the palms of my fingertips. Let me know if there's any pain too, okay?
Yep.
Submandibular, bend to his jaw, submental. Now you're turning your side to the wall, your head to the wall. Feeling for anterior deep cervical. Good. Look at this way, the other side of the wall. Good. All right, posterior cervical, you can look straight ahead. Good. And then I'm going to look at your supraclavicular, right above the clavicle. Good. So didn't feel anything. Lymph nodes can be size of a pea. No issues if they're movable. They don't cause any pain. They're not enlarged. I didn't feel any of those, any that would be cause for concern. So that looks good. Now I'm going to use my stethoscope and I'm going to auscultate in specific areas in the head and neck that we examined. Listen for any bruise. So I'm going to use the bell of my stethoscope. Listen temporal. Good. Over the eyes. Thyroid. Good. No bruise were heard on his head. Now I'm going to check for his TMJ, his temporomandibular joint. Open your mouth for me. Close. Any pain?
No.
Good. No crepiness or cracking noted. No swelling. Nothing felt out of place. No nodules. Anything like that. So head and neck looked good. No cause for concern. Now we're going to move on to vision testing. So now there's a Snellen chart 10 feet away. So I'm going to have you with both eyes open. Read the lowest line you can.
CFDHJ.
Yep. Now close one of your eyes, doesn't matter which one, and read the lowest line that you can.
EPTZO.
Yep. And then we'll do the opposite eye too.
EPTZO.
Good. So he has 20/30 vision according to the Snellen chart. Any dizziness, blurriness? Good. Now we're going to do the visual confrontation test. So just for terms of the camera, I'm going to be right here. I'm going to cover my eye. You're going to cover your right eye and my right eye, okay?
Yep.
So you tell me how many numbers you can see.
2, 1, 3, 4, 1.
Good. Same with the other eye.
2, 1, 3, 4, 1.
Good. So everything looked good there. Have you cover your eye now? And tell me when you can see my finger.
Right now. Right now. Now.
Good. Do the other eye.
Now. 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 Now.
Good. So visual confrontation's good. No blurriness was reported. He was able to see his peripheral vision and bilateral eyes, which was good. No issues there. No issues with seeing. Now I'm going to inspect and palpate your eyes. Any questions so far?
No.
Good. So looking at his orbital area, everything looks good. No masses, no bruises, no deformities, no lesions, no bleeding. Eyebrows are hair dispersed evenly, intact, no issues. No missing hair, everything looks good there. Eyelids, I'll have you close your eyes for me. Looking at his eyelids using my light. No deformities, no lesions. Are you having any pain?
No.
Good. No pain either. Everything looks good with his eyebrows and his eyes and his eyelids. No fasciculations, no tremors, no tics were noticed, anything like that. No redness or swelling. Looking at his sclera, it's nice and white, bilaterally. Good. Look at your conjunctiva, pulling your eyelids down. Good. Everything looks nice and pink in his conjunctiva. No foreign bodies were noticed in his sclera or his conjunctiva. Looked good in color. Sclera is white. Conjunctiva is a nice pink color. No discharge noticed. Looking at your external eyes, like I had my pen light here. I'm gonna look at your pupil. Look straight ahead for me. Good. See his cornea, his lens, clear. Good. Looking at his iris. His eyes are like a blue hazel in color. Same color bilaterally. No issues there. They're symmetrical. No nystagmus noted. No movement of the eyeballs. So now I'm going to check his pupils once more. Look straight ahead. Looking for accommodation, constriction. Good. Good. Good constriction. I'm going to put my hand as a divider. Good. Good. And test your pupil length. Thank you. Thank you. All right. So pupils were equal, round, reactive to light, 3 millimeters each bilaterally. No issues there. Everything looks good with his eyes. Symmetrical, no deformities, no foreign bodies noted. Everything looked good. They were equal, round, reactive to light. Now to look at your pupils a little further, feeling your lacrimal glands. Good. Any pain?
No.
No pain or tenderness, no redness or swelling in his lacrimal glands, no issues. Now I'm going to test for his extraocular eye movements. 6 cardinal fields, just follow my pen. Passed the 6 cardinal fields. Now I'm going to do the cover uncover test. I'm going to give him this spoon. Have you cover one eye, look for fixation the other, look straight ahead. Good. Switch other eyes. Good. Alright, so they were symmetrical. He passed the cover uncover test, no issues there, no issues with fixation. Now I'm going to bring up my ophthalmoscope and I'm going to look for red reflex, his lens, arteries and veins of the eye, everything like that. We're going to be looking at his lens, like I said, red reflex. Okay, so using my right eye and his right eye, coming in at an angle. Look straight ahead for me. Good. Red reflex is noted. Veins are bigger than arteries. Looking at his anterior chamber, everything looks good. Lens is clear, looking at his cornea. Awesome, everything's good. I'm going to go the other side using my left hand. Same thing. Look straight ahead for me. Using my left eye. Coming in at an angle. Looking at his red reflex, which is positive. His lens, his macula, his iris. Lens is clear. Anterior chamber. Optic disc is oval shaped. Good. Okay. Everything looks good in the eye. Like I said, saw his red reflex, looked at his iris, looked at his retina, no issues there. His veins are bigger than his arteries in his eyes. His macula is dark, oval shape for his optic disc. Everything looks good in his eyes, no issues there. Any questions so far?
No.
Alright, now we're going to move on to his hearing. Look at his auricles. Do a tug test, any pain?
No.
Good. Symmetrical, no lesions. No pain, no tenderness, no swelling. Everything looks good there. So size, shape, symmetry, everything was perfect. No deformities, no lesions, no bruising. No tenderness when palpating, no redness or swelling was noted. Passed the tug test, no issues when tugging bilateral ears. Everything looked good. Now I'm going to take a look inside his ears. The otoscope. Okay, holding the scope up. Alright, pulling his ear up and back. Alright. Everything looks pearly white, no red or bulging. Looking at his eardrum. His internal ear structures looks good. Malleus, you can see briefly incus. Any pain? Nope. In serum, there's earwaxes in there, which is good. Switching to the other side. Up and back. Alright. Same thing, pearly white, no red or bulging. Nothing looks swollen or edematous. See some cecum or earwax. Everything looks good there. Seeing his internal ear structures. Okay, good. Everything looks good in his ear. Any pain?
No.
No redness or swelling noted either. So that looks good. Everything looks great in the ear. Pearly white, like I said. No issues with color, no bulging. I saw all the pertinent landmarks bilaterally, so everything looks good. Now I'm going to move on to the hearing test. I'm going to perform 3 tests, a Weber, Ryan, and whisper test. First test, I'm going to hit it on my hand, put it on top of your forehead, and you tell me which vibration you hear in your left or right ear.
Okay.
Or both.
Both.
Good. Okay, so past that, now the Ryan test, or Reen test. I'm going to pound it, put it over the mastoid bone, and you tell me when you stop hearing the vibration, okay?
Yep. Cannot hear it.
How about now?
Yeah.
Okay, same thing on the other side. Mastoid bone. Okay, when you stop here, then I'll switch positions.
I can't hear it.
How about now?
Yep.
Okay, air conduction is greater than bone conduction, which is good. Now I'm going to do the whisper test. I'm going to stand behind you. I'm going to cover one ear and you tell me the 2 words I whisper, okay?
Yep.
Baseball, apple.
baseball apple.
Yep. Now I'm gonna try his left ear, including it. Take a deep breath and whispering 2 more words. Golf. Puck.
Golf puck.
So adequate hearing in both ears. Whispered the short words in both ears. Testing his right and left ear while occluded. Everything looks good. No issues with hearing. Any questions so far?
No.
Good. All right. Now we're gonna move on to inspecting, palpating, kind of looking at the nose. Okay.
Yep.
All right. I'm gonna get my pen left here for a minute. All right. Any pain?
No.
Good. Feeling for masses, looking for swelling, size, shape, color, symmetry. Everything is symmetrical, no lesions noted, no masses, no pain, no tenderness, so everything looks good there. No masses were felt, feeling for bone cartilage, everything's intact. No bone fragments, anything like that. Now I'm gonna hold one nostril down and inhale for me. Good. Other side. Good. So he has patency in both nares, was able to breathe out of one with the other occluded. Now I'm going to look inside his nose and examine his nasal mucosa. You tip your head up to the sky for me. Good. No redness or swelling or lesions. No redness, swelling, or lesions. I'm going to look at it again with my otoscope. Just taking a deeper look. Alright. Same thing. No redness, swelling, or lesions. No redness, swelling, or lesions. Everything looks intact nasally. Mucosa's pink, dry and intact. So everything looks good there. Already palpated the sinuses, frontal and maxillary. No tenderness was noted. No discharge from his nose, no perforations internally or externally. No deviations or swelling was noticed as well. Alright, any pain in your nose when I was touching? I know you.
Mm-mm.
Well, good. Now we're going to move on to his lips, mouth, and throat. Looking at his lips, looking for color, looking for chapping, looking for symmetry. Lips are symmetrical, no edema, no cracking, no chapping, no cracks. Color is adequate for ethnicity, a light pink. No edema. Let me break up my pen light again. Have you smile for me or open your teeth. Good, no cracking. Open your mouth for me, please. Good, all teeth are intact, no loose teeth. Everything is pink, moist, and dry. No issues. Looking at gingiva and the buccal mucosa, pink, moist, and intact. No lesions. Any tenderness in your mouth?
No.
Good. Soft palate and uvula, say ah for me. Good. Uvula and soft palate intact, symmetrical. Was able to see his tonsils when he said ah. No swelling or deformities in his mouth at all. No lesions, no bruising. No missing teeth, no lesions, anything like that. So everything looked good. Good uvula and soft palate. Like I said, no lesions noted on there as well. So everything's looking good with his tonsils in his mouth. That kind of wraps up the inspection of the mouth. Do you have any questions for me?
No.
Alright, now we're going to move on to the inspection and palpation of the chest and lungs, okay?
Yeah.
Are you having any shortness of breath?
No.
Any cough?
No.
Any chest pain or like chest tightness?
No.
Heart palpitations?
No.
Good. So subjective data is required. I'm looking at his respiratory rate. No accessory muscles are noted. He doesn't look at any respiratory distress. Respirations, the rate and rhythm are equal and smooth. About 18 breaths per minute, which is normal. Everything looks good there. Chest is symmetrical up and down. Like I said, no accessory muscle usage, just some quick observation. So everything looks good there. Now I'm going to also take his anterior, posterior, and lateral chest and lungs. Listening for crackles, rails, wheezes, rhonchi, or friction rubs. Using my diaphragm. So every time I move my stethoscope, just try to give a deep breath, okay?
Yep.
Pick your arm up for me. Lateral. You put your arms down. Alright, give you a break. Anterior, lateral, no adventitious breath sounds were heard. Everything is smooth, clear, and intact. No wheezing, crackles, rhonchi, stridor, or anything like that. So give you a break for a second, I'll listen to your back.
Alright.
Alright.
Yep.
So Two more deep breaths for me.
All right, awesome.
Thank you.
Yep.
Okay, so breath sounds sounded good. They were clear. Like I said, no adventitious breath sounds heard anterior, laterally, or posteriorly. Now I'm gonna have you kind of put your back towards me
Okay.
a little bit. That's good right there. Testing for thoracic expansion. So put my hands around his 10th rib. Have him do a big exhale, or inhale, then a big exhale. Same with my hands. So 10th side, big exhale. Big inhale and exhale. Good. So my hands came together symmetrically. There's no deviations to one side, so that looks good. Now I'm going to chest for crepitus, feeling down your back. You tell me if there's any pain, okay?
Yep.
No pain. Everything feels good. Down his spinal column, cervical, thoracic, and lumbar. Behind his scapula. Any pain?
Nope.
No redness or tenderness. No crepitus noted. Everything looks good there. No issues. No crepitus. Felt the spine and the scapula. It felt good. Now I'm going to test for tactile fremitus. I'm going to take my ulnar surfaces of my hands and feel for vibrations. So just say 99.
99, 99, 99, 99,
And do lateral. Same thing.
99, 99,
And then anterior.
99, 99, 99.
Good. Vibrations were felt equally and bilaterally. No issues. Posterior, lateral, and anterior. Everything sounded good. Felt the vibrations on the ulnar surface of my hand. Now I'm going to test for diaphragmatic excursion, percussing, auscultating, and feeling your chest and your lungs. So we're going to move on to that portion of the exam, okay?
Yep.
So what I'm having you do is take a deep breath and hold it in. I'm going to find when resonant turns to dullness, okay?
Yep.
Big inhale and hold it. Alright, I'm going to mark it with my pen. Okay, big deep breath, or you can exhale now. Alright, so looking when that sound goes from resonant to dull. Big inhale, then exhale, and hold that exhale completely, okay?
Yep.
Ready?
Yep.
Go. And then exhale, and hold that exhale. Alright. Okay. Mark. Alright, I'm going to measure the difference between that. So normal should be between 3 and 5 centimeters. Everything looks good. I'm going to measure 4 centimeters. Okay, that looks good. Now I'm going to take a deep breath and check for vocal resonance, okay?
Yep.
So I'm just going to have you say 99 when you hear my stethoscope move, okay?
Yep.
Using my diaphragm. Ready?
Yep. 99, 99, 99, 99, 99, 99,
Listen with the anteriorly.
99, 99, 99, 99, 99.
Good. So we're just testing for bronchophony or egophony. Everything sounded good. No muffled sounds. So everything looks good there. Have any questions so far?
No.
Alright, now I'm going to inspect and palpate your precordium. So I can have you face the camera. Good. Everything's good there. This, tactile firmness. Awesome. Okay. Now using tangential lighting, have you pull your gown on so I can see your chest. I'm going to check for major anatomical landmarks, his apex of his heart, sternal borders, the sternum, everything like that. Looking for his apex, sternal borders, everything is good, clavicles intact. I'm going to feel for pulsations. Good. Palpate for heaves or thrills using my whole hand. Good. Any pain?
No.
All landmarks are there. No pain, no tenderness, no swelling, no obvious 5+ bounding pulses in his chest. Now I'm going to palpate for thrills using the palm of my hand. Good. So no heaves, thrills, or Lifts noted, everything looks good. I'm going to test for apical pulse. I'm going to have you lay flat. Alright, it's about the mid-clavicular line, the 5th or 6th intercostal space. Feeling for that apical pulse. Good. Now I'm going to have you turn on your left side and face the wall. Still feeling for that spot. Good. Okay. Awesome. You can sit up now. Thank you. Okay. So now let's start inspecting and palpating the pericardium. Everything looks good there. Now I'm going to auscultate your heart. Okay?
Yep.
Just make sure everything else is all situated over here. All right. Using the diaphragm, my stethoscope, breathe normally. I'm going to listen to all 5 points of your heart. Aortic. Pulmonic. Herbs, mitral, or tricuspid, and mitral. Listening to the S1 and S2 sound, no S3 or S4 heard, or any splitting, so everything sounded good, just heard the S1 and S2. Now I'm going to switch to my bruit, or the bell of my stethoscope, and listen for any bruits in the same spots, okay? This time hold your breath for me. Okay. Aortic. Pulmonic, herbs, tricuspid, mitral. Okay, so no bruise were heard. Thank you.
Yep.
You all set there. Everything looked good. Didn't hear any murmurs, no heart murmurs or any bruise, nothing like that. No adventitious heart sounds, so his heart was good. Now I'm going to inspect your abdomen so you can lay flat. And I will have you head over the pillow. I'm just going to lift up your gown, okay?
Yep.
And just expose your stomach. Just inspecting the stomach, looking for skin characteristics, any venous return. Everything looks good, symmetrical, no lesions, no deformities, no bruises, anything like that, no swelling. Good venous return, everything looks great there. Surface motion's adequate, so nothing, no cause for concern. Any pain in your stomach that you noticed?
No.
Alright, now I'm gonna have you sit up like you're gonna do a crunch. Real quick for me. Right there. No hernias noted, no muscle striation, muscle separation, everything looks good, you can lay flat. No masses were obviously seen, no hernias that were apparent to the eye, everything looks good. So that looks great. Now I'm going to listen to your bowel sounds, okay?
Yep.
Should be about 5 to 35 minute irregular gurgling. Listening is right lower, right upper, left upper, and left lower. Good. So bowel sounds were active in all 4 quadrants. Nothing, no hypoactive, hyperactive sounds. Everything looks good there. Now I'm going to take the bell of my stethoscope and listen for arteries, okay?
Yep.
Listening for abdominal aorta, renal arteries, iliac arteries, and then femoral below the waistline. So no breeze were heard, nothing, no suspicious abdominal sounds, everything looked good. I'm also going to listen over the liver and the spleen for any bruise or liver, spleen. Okay. No bruise were heard, liver and spleen, everything sounds good. Let's see here, we're going to move on to going to percuss all quadrants of his abdomen, okay? Tell me if there's any pain, alright?
Yep.
Hearing tympany. Dullness over the liver and the spleen, which is normal. Any pain?
Nope.
Good. No pain. Now I'm going to assess the liver borders, starting in his tympanic area, moving his way up to heel dullness, or his tympanic area of his stomach, working my way up. Measuring that point. There is a freckle there, which is good. Alright, marking that spot. Freckle. Same thing at your lung field coming down, okay?
Yep.
right there. Going from tympanic or resonant to hear dull sounds. I'm gonna grab my ruler and measure that distance between the liver borders. Okay. Normal is between 6 to 12. Should be 7 centimeters. Everything looks good. Any pain?
No.
Good. So that looks good. Now I'm gonna check for splenic dullness. Moving down the left axillary line. Moving down when I'm hearing tympany. Then have you take a deep breath at that spot and let me know if any pain. Okay.
Yep.
All right, here. Deep breath for me. All right, the sound was tympanic the whole time, no splenic dullness, so that looks good. That was assessed. I'm gonna assess with the gastric air bubble, starting at like that 5th or 6th intercostal space, working my way down, hearing resonance, listening for tympany. Good. So gastric air bubble was present. Splenic dullness was there, or not dullness. Splenic dullness test was failed. He didn't have any dullness when he inspired, so that looks good. Now we do it. Lightly palpate all proportions of your abdomen using one hand, okay?
Yep.
Feeling for any masses. Any pain?
Nope.
Right upper, right lower, left upper, left lower. No masses were felt, no striations, no bulging, no nodules, anything like that. Everything felt good. No pain, no tenderness, no swelling. Now I'm going to do a deep palpation using both hands. Everything feels good. Any pain?
Nope.
No pain, tenderness, swelling are noted, so everything looks good. Now I'm going to measure his liver borders using 3 techniques. Using both hands, I'm going to be pressing upwards, feeling for his liver border. Sometimes you can and can't feel this way. Good. Right there. Now I'm going to use the second technique, putting my hand under his and putting this right hand under his sternum or his rib cage. Pushing his costal margins. Okay, looks good. And the last technique for liver borders is the hook technique. I'm going to stand in front of him and hook my hands under his rib cage, feeling for his liver. Good. Okay. So if liver was palpated, everything feels good. No pain. Now I'm going to palpate your gallbladder. Okay.
Yep.
Have you take a big exhale. Okay. I'm going to feel for your gallbladder. Good. Now take a big, slow inhale. Any pain? Good. So negative Murphy sign, no pain in the side of his gallbladder. Everything looks good there. Now I'm going to palpate his spleen. We'll lift you up. You feel it. Any pain?
Nope.
Good. Coming in at like a 45-degree angle. Getting under that rib cage. All right. Everything looks good. I'm going to palpate your kidneys using both hands and compressing. Kind of palpating. Any pain?
Nope.
Good. On this side. Any pain?
Nope.
Good. So no issues bilateral kidneys. Palpating your aorta, okay? Any pain?
Nope.
Good. Now you can have him sit up. Now I'm going to have you just stay right where I'm looking at the wall. I'm going to test for CVA tenderness or costovertebral angle tenderness. Tell me if there's any pain, okay?
Yep.
Any pain?
Nope. Nope.
Any pain? No pain. This costovertebral angle, no kidney pain noted. Everything looks good there. Do you have any questions for me so far?
No.
All right. Now I can have you face ahead again. I'm going to inspect, palpate, and auscultate your major blood vessels, meaning like your arteries and veins, okay?
Yep.
I'm kind of looking at peripheral veins and arteries, checking color, hair texture, no muscular edema, no varicosities, warm in temperature. Everything looks good in his arms. Same with his legs. No varicosities were noted. Skin smooth texture, color appropriate for ethnicity. No edema, no pitting edema. Everything looks good. Palpate his pulses. His radial. 2+, ulnar. 2+, brachial. 2+. Feel the other side now. Radial. Ulnar. Brachial. All 2+. Now look at his lower extremities. His popliteal. Posterior tibial. dorsalis pedis. Good. I do the same bilaterally, but this side 2+. For the sake of time, we won't. Or 2+ extremities. No bounding pulses, no diminished pulses. Everything looks good there. When I was feeling his extremities, they were warm. Like I said, no pinning edema, no tenderness, no pain reported. Now I'm gonna have you lay flat one more time, okay?
Yep.
Inspecting for jugular venous distension. I'm gonna grab my pen light. Assessing his JVD or pulsations. We'll have you look straight ahead. Using tangential lighting. No. Have you look at the wall? Good. Looking at the pulse waves of the venous, jugular and carotid. Venous waves are not palpable. Arterial waves are. We're just looking at the AV waves. Good. I'm gonna have you sit up at a 45-degree angle, kind of like you did earlier. Doing the same thing. Assessing for any jugular venous distension. Nothing. Good. Look at the wall for me. Good. No JVD was noted, which is good. No signs of congestive heart failure. Have you sit up normally now. So everything looked good there. Like I said, extremities are warm, dry, intact, appropriate for ethnicity, symmetrical. Everything looks good. 2+ pulses everywhere bilaterally. Any questions so far?
No.
Good. Like I said, everything is warm, clean, dry, intact. No lesions, no deformities, no swelling. No JVD noted. Now I'm going to inspect, palpate, perform several neurological tests, okay?
Yep.
Olfactory nerve number 1. Have a scent and have you smell it with one side.
Lavender.
Yep. I'll grab a different one. All right.
Lemon.
Yep. All right. So both nerves are good. Olfactory nerve is passed. Looking at number 2, have you cover your right eye. I'm going to cover mine. Tell me how many fingers you can see.
2, 3, 1,
Yep. Okay. Same thing other eye.
2, 2, 3, 1.
Good. While your eyes closed too. Now you just keep that same eye closed. Tell me you can see movement.
Yep. Yep. Yep.
Same thing with the other eye. We'll test it again.
Yep. 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 Yep.
Good. That was optic nerve number 2. He was passed. We did the Snellen chart already. He was 20/30 vision, both eyes, so we're good there. Now we're testing nerves 3, 4, and 6, testing for nystagmus and double vision. Cardinal fields we already performed. There's no issues there. Have you look ahead. I'm going to have you just look straight ahead. Testing for light reflex. Yep. Seen the light symmetrical in both eyes. No deviations in one eye's coming in or coming out. Everything looked good there. Like I said, we tested the cardinal fields already, so in the sake of time, we're going to hold off on that. He was past the 6 cardinal field tests, no issues. Let's see here. You tested the light reflex. Looking at your pupils, see if they restrict, constrict. Good. Good. Both constricted when shown to light. No issues there. Testing for accommodation. Have you follow my finger straight in? Looking at the pupils constricting. Good. Pupils constricted, so everything looked there bilaterally. One, it was symmetrical on both sides. No issues there. Tested accommodation. Perla. Pupils were equal, round, reactive to light. Everything looked good there. So 4 is done. I'm going to test 5, trigeminal. And how do you clench your teeth? Feel your masseter muscle. Feel your temporal muscle. And open your mouth against resistance. Good. All facial muscles are intact, no issues there. Number 6 we tested. Not for 7, the facial nerve going to have you make some faces at me, okay? So I have you close your eyes tightly. Open. Smile. Frown. Puff out your cheeks. Good. Test sensation. Tell me if you can feel this, okay?
Yeah.
Close your eyes and tell me when.
No. 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 No.
Okay. So good facial sensation. Have you do the same thing with something sharper.
No. No. No.
Good. So sensations appropriate for his face. He felt soft and dull. Everything looked good. For the acoustic, number 8, we already tested the Weber, Ryan, and Whisper test. He passed. No sense to do it again, so everything looks good there. The acoustic nerve is great. Test the vagus nerve. How do you swallow? Good. Any issues swallowing?
Nope.
Good. Vagus nerve is intact. That looks good. Spinal assessor. Shrug your shoulders. Good. Any pain?
Nope.
Symmetrically, he was able to do that on both sides. No issues. Then for the last nerve, cranial nerve number 12, the hypoglossal. Stick your tongue out. Move it back and forth. Good. Everything's good. He was able to move his tongue freely. No issues there. So that kind of wraps up the cranial nerve assessment. We're going to move on to the cerebellar function and proprioception. Some test rapid movements, alternating rhythms, okay, of your upper and lower extremities. So I'm going to have you touch my index finger and touch your nose with just your left hand.
Left.
Yep. As fast as you can. Good. Right hand. Good. Everything looks good there. I'm going to have you flip your hand in and out like that as fast as you can. Good. Same thing with our side. Awesome. Good. Now, another test, I'm going to have you touch each of your fingers to your thumb as fast as you can. Good. Other finger or other hand. Awesome. Now I'm going to have you stick your hands out straight, close your eyes, then touch each hand with your nose, or each index finger to your nose. Good. Good. Okay, open your eyes. Testing is lower extremities. Now I'm going to do the heel to shin test. Take your right heel and rub it up and down your left shin as fast as you can. Same thing with the other side. Good. No limitations there. Now I'm going to have you stand up and we're going to perform the Romberg test.
Alright.
Give yourself a hug like this and just stand still. Gonna assess for 30 seconds and see how he does. Look for any movements, any swaying, any difficulties with balance. Okay, good. Now you do the same thing with your eyes closed. Looking for any swaying, any difficulties with balance, anything like that. Okay. All right, good. No swaying. Everything looks good. Balance is intact. Now I'm going to have you just walk from wall to wall, looking at his posture, looking at your gait. Good rhythm, good sequence of stride, good arm movement. Awesome. You'll do the same thing with your tippy toes. Gait's positive, good pattern, good posture. Slight slouch, good rhythm, sequence of stride and arm movement. Everything is there. Now I'm going to have you sit up on the chair again. We're going to assess for sensory function, testing primary sensory responses to like superficial touch and pain.
Okay.
So using this cotton, I'm just going to touch some areas. Let me know if you can feel it.
Yep. Yes. Yes. Yep. Yep. Yep.
Legs.
Yep. 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 Yep.
Good. Now I'm going to use something sharper.
Yep. 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 Yep.
All right. Now you close your eyes. You tell me if it's sharp or dull. Okay.
Yep.
Sharp or soft.
Soft. Sharp. Sharp.
Yep.
Sharp.
Yep.
Soft.
All right. He was able to delineate between sharp and soft. All his extremities, everything looks good. Now I'm going to test for perception of position and sense of movement. I'm going to take your index finger and move it up and down, flex it, extend it. You tell me what I do.
Flex. Extend. Extend, sorry.
Yeah.
Flex.
Good. All right. Same with our hand.
Extend. Flex.
Okay, so everything looks good with his index fingers. He's able to delineate proprioception. What I was doing with his index finger bilaterally. Now I'm going to take this tuning fork and touch some bony prominences. You tell me if you feel vibration.
Yes. 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 Yes.
Your arm.
Yes. Yes. Yes.
Good. Able to feel vibrations bilaterally in upper and lower extremities. Now I'm going to have you close your eyes. I'm going to put an object in your hand, and you tell me what you feel, okay?
Yep.
Object number one.
Battery.
Yep. And let's see this next one.
Pen.
Yep. Good. So you got them both right. He was able to pick up the objects. Now I'm going to assess for 2-point discrimination. You tell me if you feel 1 or 2 points, okay?
Yep. 2.
How about now?
1.
How about now?
1.
How about now?
2.
Good. Alright, so did good with that. The 2-point discrimination test using a tool. He was able to delineate between 1 and 2. Everything is good. I'm going to have you close your eyes and hold your palms out like this. I'm going to draw a letter. or number, sorry, and tell me what it is.
0.
Yep. And then
1.
Yep. He was able to gauge the numbers as you with his eyes closed. Everything looks good. Now I'm going to test your reflexes. Have you lay flat. Test your abdominal reflexes. Okay. Lift your gown up one more time. Away from his umbilicus down. Sideway. Sideway. And upward against his umbilicus. Looking for reflexes. They're all 2+. Good. Alright, I'm going to have you sit up and we're going to test your other reflexes, okay?
Yep.
Alright. Alright. Testing your plantar reflex. I'm going to take the bottom of my tool, going up the lateral side of your foot. Check the Babinski reflex, okay? Good. We're looking for fanning of the toes. There's none of that. Same thing on the other side. Good. So good plantar reflex, just toes in fans or fans, and no Babinski reflex, which is good. Now I'm just going to test your deep tendon reflexes, okay?
Yep.
Test your bicep, find the tendon. Good. Testing the other side. I'll switch sides. Good. Brachial. Good. Another brachial radialis. Good. We're just looking for that contraction of the arm and hand. Now we're going to do your tricep. I'm going to hold your arm like this. Feel your tendon. Good. All reflexes have been 2+ so far. Same thing. Let your arm dangle. Good. Okay. Brachial radialis, bicep, tricep, all looks good. Now I'm going to go to his lower extremities, his plantar. Let your knees just dangle. Feel your tendon. Good. Feel your, right under your patellar. Right below it. Okay. Good. So we're just looking for that reflex, kind of the jolt extension. Everything looks good. Now the Achilles, I'm going to dorsiflex your foot, find your tendon back here. Tendon. Ready? Good. Same thing, dorsiflex. Find your tendon. Good. Looking for that dorsal flexion of the foot, which was 2+ on both sides. So everything looked good there. No issues. Now we're going to test for ankle clonus. Just going to move his foot up and down rapidly a couple times and hold it and dorsiflect. Good. No response. Okay, so no ankle clonus bilaterally. Everything looked good there. Now we're going to finish up with this head-to-toe examination. We're going to look at your extremities. We're going to round it up. Inspection and palpation of your muscles. We kind of did that so far, but we're just going to finish it up, okay?
Yep.
Any questions, concerns thus
No.
far? All right. So now we're going to look at your skeleton, looking at size, looking at alignment. Everything is symmetrical. No deformities of bone in place. Bilateral lower extremities look good. No deformities. Good contour. They're both symmetrical, very well aligned. No issues there. Good subcutaneous fat dispersion, good muscle size. Everything looks good. Color is appropriate for ethnicity, like I said. No lesions were noted, no bruising, no skin fold, no masses are felt. Bilaterally, everything looks good. Alright, no masses, everything looks good. Some muscles, like I said, good muscle size, good subcutaneous fat dispersion, even ratio. No signs of any malnutrition, anything like that. Looks good. No fasciculations or spasms noted on the body, no tics. Muscles are symmetrical, one side's not bigger than the other. Bilateral lower extremities, everything looks good. I'm gonna let you know any tenderness.
No.
No muscle tenderness, no swelling, no crepitus, no joint pain, no pitting edema. Any pain?
No.
Any pain?
No.
Good. No redness, edema, no swelling, no pain, everything looks good. No crepitus, everything looks great for that. Now I'm going to test for passive and active range of motion as well as strength. So I'm going to have you take your fingers like this, flex and extend, do it yourself. Then your wrist as well, passive motion, do with both. Good. Grab my hands, squeeze, Good. Bilateral strength, 5+ on each side. Full range of motion. Take your fingers and adduct and adduct. Abduct and adduct. Good. And same with your wrists. Add an abduct. And circular motions. Good. So didn't feel any masses, no rheumatoid or osteoarthritis. On his radial ulnar heads, everything is symmetrical. Good extension, flexion of the fingers and wrists, adduction, abduction. He's able to grip my fingers. I'm gonna have you take your hands like this. Any pain?
No.
Good. Carpal tunnel test was negative. 5+ strength, hands, fingers, wrists. Everything's good. Any questions?
No.
Gonna go to your elbows. Palpating your olecranon process, which is the tip of the elbow, the medial and lateral epicondyle. Any pain?
No.
Good. Have you flex and extend. Same thing the other side. Flex, extend. Now I'm gonna have you go like this, and pronate, supinate on both sides. Yep, good. Able to supinate, rotate, flex and extend elbows. Everything looks good there. Do it against resistance. Just go flex, extend. Good. 5+ strength in his elbows. So that looks good. No issues. 5+ shoulders too. I'm gonna feel for any deformities, any anomalies. Good. Any pain?
Nope.
Palpating the suprasternal notch along the clavicle to the acromion process. Medial is that AC joint. And then moving down to the deltal pectoral groove, feeling that coracoid process. Same thing with the other side. Acromion, AC, coracoid. Okay. Now I'm going to have you stick your arms out like this. Back, I'm going to have you put it behind you. Good. Good flexion, extension, then against pressure. Good. Looks good. I'm going to do arm circles small and then big. Any pain?
No.
No crepitus, no swelling, no pain, no redness. Now I'm going to have you take your right arm, we're going to cross your chest like this, straight up, pull your arm straight, just like this. Now go right out, down, out. Do the same thing with left arm, out, hip crossed, adduct, abduct, down, out. Okay, everything looks good there. 5+ strength in the shoulders, full range of motion. I'm going to have you take both arms, scratch your neck. Then behind your back and act like you're scratching your scapulas. Any pain?
No.
Good. 5+ strength in his shoulders bilaterally, full range of motion. Everything looks good there. Your TMJ, open your jaw, close. Good. No crepitus felt, no pain, no swelling, no tenderness. Looking at a cervical spine, trachea is midline. Have you put your chin to your chest. Just like this. Good. Come up. Good. Look at the ceiling, so good extension. Turn your head to this wall. Good. Same to the other side. Good. 5+ strength, good rotation. And keep your head in a big circle like this. Good. Now take your right ear and touch your right shoulder. Same with the other side. Any pain?
Nope.
Good. No pain or tenderness, full range motion, 5+ strength in the cervical spine. Now I'm going to have you stand up. We're going to check his thoracic and lumbar spine. I'm looking at his curvature. It's concave, convex, and concave again, which looks good. Any pain?
Nope.
Palpating from the C7 down to his lumbar. Good. No pain. And no muscle spasms, no crepitus. Have you touch over and touch your toes. Flexion. Back for extension. Good. I'm going to have you just drop down to your right side as far as you can like that, and left side. Now push, you can go flex again with your chest and feel better. Good. Now back. Good. 5+ strength, full range of motion is thoracic and lumbar. Now same thing, face the wall. Feeling his hips, bend over a little bit. Hips are even, no displacement of the hips, no limb is longer than the other. Now wrapping up, while you're standing up, have you do your hip assessment. I'm gonna have you squat down. Any pain?
No.
Good. I'm gonna have you take your leg like this and rotate it out. Same thing with your left leg. Awesome. Now, good. Now you lay flat for me. Your head on the pillow. Alright. Gonna passive range of motion, leg up to the sky. Do it with both legs now, one at a time. That works too. Good. Now lay on your side facing the wall. Now abduction. Any pain?
Nope.
Good, and do it yourself. Good. Now lay on your belly. Watch out for the table. One last time. Good. Now do it yourself. Good. Now you can lay on your back again. Watch out for the table. I got it. Okay, so full extension of the hips. Everything looks good. Take your leg, bend your knee in. Any pain?
Nope.
Good. You want to do that yourself now? Good. For the size, for the table being so small, we won't have him do his left. You can maybe do your left leg. Yeah, you have enough room. Okay. Good. Any pain?
Nope.
Full range of motion in his hips. 5+ strength. No issues. No unilateral asymmetry. Have you sit up? Just with the table being so small too, we lay him on his side, kind of have him spread out. We check for his great outro canter and ischial tuberosity, checking for any sciatica, but in terms of the table being the size it is, we are going to not do that one. Looking at your legs and your knees, palpating your knee, your tibial and fibial condyle, kneecap, patella, tibial tuberosity, medial meniscal, and lateral meniscus. Good. We extend and flex your knee. Do both sides now. Good. And have you invert. Any pain?
Nope.
Any pain?
Nope.
You do that yourself now. Good. And your toe, I'm gonna have you put your feet down and up, in circles. And evert, if you can just put your toes in. Good. Any pain?
Nope.
Good. One more time against resistance. Good. And flex and extend. Good. 5+ strength in his feet, his knees. No issues, no pain. Full range of motion bilaterally, no issues there. Everything looks good. Now I'll have you stand up real quick. Feeling behind his knee. Forearm fossa. Any pain?
Nope.
Good. Okay. Alright. I'm gonna have you on your tippy toes, looking at your feet and ankles, well, weight bearing, looking good contour, good alignment with tibias, all 10 toes, everything looks good. You can sit back down. Feeling for the arch of his foot, good arch, no pain, all 10 toes, metatarsals, his calcaneus, heels, metatarsals, everything looks good. Full range of motion, his feet, ankles, knees, 5+ strength in all extremities, no issues, no deviations. Do you have any questions for me?
No?
And that will be it. Thank you.
Awesome.